So let's talk a little bit about expectations for evidence, what constitutes good evidence, whether it's clinical or cost evidence, and really what are we looking for today in terms of outcomes? What are the expectations now that weren't there 10 years ago?
I think there's a bigger emphasis on true clinically relevant outcomes. I think to the most part, if you're going to talk to payers, they will tell you, well, how does the outcome change and what does it cost to get to that change? So I think we need to find ways to really demonstrate clinically meaningful changes in outcome. So if you have a drug, you need to demonstrate, how is the patient quite literally better off at a certain point in time than they were without the drug. I think everybody understands that, everybody acknowledges that this is the way that we want to practice medicine. If you're looking at it from the perspective of, for example, diagnostics, I think there we really are starting to understand better how to approach that evidence mechanism. And that has a significant impact on the drug side as well, because now we have mechanisms to evaluate the potential for an outcome before exposing people or patients to drugs and interventions. So if you take all of that into one view, you have a much more complex system. And I think both drug manufacturers, diagnostic manufacturers, but also payers are starting to realize that. Because if you can predict with whatever certainty a particular outcome, you're probably going to use such a mechanism to look at whether or not the exposure is necessary in the first place. So that fundamentally changes our value proposition in such a way that we're introducing additional technology and knowledge to measuring the potential for outcome